One of the treatments for agoraphobia is where the therapist or psychologist would sit down with the individual and agree a kind of a hierarchy of situations that they would find really anxiety provoking. And the top of that list, number 10, for example, would be the most challenging. For example, that might be going through a busy supermarket by themselves. Whereas number 1 would be the least challenging situation, which could be for some people standing on their doorstep with the door open for a few minutes, and with the anxiety that provokes. They manage the anxiety gradually, because the more often that we carry out these interventions, the exposures rather, the less anxiety they provoke. So the idea is that with this hierarchy of 1 to 10 challenging situations, the individual would start off with the least challenging and keep on doing that several times a day, ideally, until the anxiety comes down to manageable levels or the anxiety almost disappears. Then they would move on up the hierarchy to number 2, which is a bit more challenging, and so on and so forth, until they work their way through gradually. There's no rush. They work their way through all the situations on their hierarchy, and with or without support in those situations, so depending on the individual's needs. And the idea is that the repeated exposure, repeatedly exposing ourselves to these challenging, difficult situations, gradually reduces the anxiety that we feel in each of those situations. So we work our way through that hierarchy, and towards the top end, the most challenging, we're able hopefully to go to the supermarket by ourselves and manage the anxiety that might be associated with that. And remember, in general, as long as it's safe to do so, in general, the more often that we do something that provokes anxiety, is the less anxiety we feel over time. It's a basic behavioral, a law of behavior in a sense. It's repeated exposure, and that brings down anxiety. In another one of my videos, I'll be talking about agoraphobia specifically, and what the symptoms of that are and how that might be assessed and diagnosed. But in this video, I just wanted to talk about one of the interventions. There are many interventions and treatments for agoraphobia, but repeated exposure using a hierarchy of situations is just one of those interventions.